Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying.
Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine.
Healthcare workers around the world are asking for help. They're in desperate need of more PPE, also known as personal protective equipment. Stocks of the critical gear are disappearing during the coronavirus pandemic. Doctors say they are rationing gloves, reusing masks, and raiding hardware stores.
Ventilators. We need 30,000. We have, in the existing hospital system, 4,000 ventilators. This is just in the normal operation of hospitals, etc. We have purchased 7,000, and we are still shopping. Several times, I spoke with him last night, I spoke with him this morning. I've spoken to people in the White House who are handling these operations. I've spoken with the Vice President. I've spoken with Jared Kushner, who is a New Yorker. He knows New York, and he's working in the White House, and he's been extraordinarily helpful on all of these situations. What we're working on is a common challenge. No one has these ventilators, and no one ever anticipated a situation where you would need this number of ventilators to deal with a public health emergency. So we have purchased everything that can be purchased. We're now in a situation that we're trying to accelerate production of these ventilators, and a ventilator is a complicated piece of equipment. The president and his team, I think, are using the DPA well because it's basically it's a leverage tool when you're dealing with private companies, right? We need your help. We can demand your help, or you could agree to help, and we need you to step up and increase production. Even with that, there's a ramp-up time for a company to put together the supply chain, put together the workforce, and get these things up and running. So Ford, you hear, is going to help. General Motors is going to help. The problem is our timeline is so short. We're looking at an apex 21 days in that range that are dealing with it. I brought down a shipment to New York City yesterday. Today, no hospital, no nurse, no doctor can say legitimately, I don't have protective equipment. Right now, and for the foreseeable future, we have a supply. We do not yet have secured a supply for 3 weeks from now, 4 weeks from now, 5 weeks from now, but we are still shopping. And taking care of this immediate need was also good news and a good job by the team. And again, we are still shopping for more equipment. Federal government has sent 4,000. We're exploring splitting, where one ventilator could do 2 patients. Italy has had to do this because they were forced to do it. I want to see if we can study it and do it a little smarter and have a little more time experimenting with it. But we're looking at splitting the ventilators. We're still working with the federal government to try to find more ventilators, but that is our single greatest challenge, are the ventilators. Again, the ICU beds, that really means a ventilated bed, because, again, this is the number one piece of equipment that we need. You have beds, you have equipment, you need staff, and you need staff understanding that some staff is going to get sick, and they're going to be out. So we have been working on putting together a surge healthcare force.